The specter of a global pandemic has loomed large for years, a constant reminder of our vulnerability to infectious diseases. While we have battled outbreaks before, the confirmation of America's first severe case of H5N1 bird flu in Louisiana serves as a stark reminder that the threat is real and present. This development, unprecedented in the United States, has sent ripples of concern throughout the nation and the world. The virus, previously confined to milder cases in the U.S., has now taken a more serious turn, raising questions about its potential to spread and mutate. The case in Louisiana, a grim milestone in the fight against infectious diseases, underscores the importance of vigilance and preparedness in the face of a constantly evolving health landscape. This is not just about one case. It's about the potential for a much larger outbreak. The possibility of a virus, capable of causing severe illness and death, gaining a foothold in the U.S. is a sobering thought, one that demands our immediate attention and proactive measures. The severity of the Louisiana case distinguishes it from previous bird flu infections in the U.S. Unlike earlier cases which presented with mild symptoms, this case has led to hospitalization, highlighting the potential for serious health complications. This development has rattled health officials and the public alike, signaling a change in the virus's behavior and its potential impact. The patient, whose identity remains confidential, is currently under close medical observation, their condition a cause for concern and a reminder of the virus's potential to inflict serious harm. The fact that this is the first severe case in the country emphasizes the unpredictable nature of infectious diseases and the need for constant vigilance. This case serves as a stark warning, a wake-up call to the potential for this virus to evolve and pose a more significant threat to human health. The severity of the infection underscores the need for increased surveillance, rapid response measures, and public awareness campaigns to mitigate the risk of further spread. The Louisiana case has brought backyard flocks into the spotlight, revealing a potential source of infection that had not been a major concern in previous U.S. outbreaks. The patient's exposure to sick and dead birds in their backyard flock highlights the importance of biosecurity measures, even in residential settings. This revelation has significant implications, as it suggests that the virus is not limited to commercial poultry farms, which are typically subject to stricter regulations and surveillance. Backyard flocks, often smaller and less regulated, could become reservoirs for the virus, posing a challenge for containment efforts. The discovery of this transmission route underscores the need for broader public education campaigns, emphasizing the importance of biosecurity measures for anyone keeping birds, regardless of flock size or location. It also necessitates increased surveillance of backyard flocks to identify and contain outbreaks promptly. The confirmation of a severe bird flu case in the U.S. has put public health officials on high alert, prompting a flurry of activity aimed at assessing the risk and containing the virus. The Centers for Disease Control and Prevention, CDC, is working closely with state health departments to investigate the case, trace contacts, and implement control measures. While the CDC maintains that the risk to the general public remains low, the severity of the case has raised concerns about the virus's potential to spread and mutate. Health officials are urging the public to remain calm but vigilant, emphasizing the importance of following preventive measures to reduce the risk of infection. Public health agencies are actively monitoring the situation, enhancing surveillance efforts and preparing for the possibility of more cases. The focus remains on containing the virus, preventing its spread, and protecting the health of the American public. Section 5. Shielding ourselves, preventive measures. In light of the recent bird flu case, the CDC has reiterated the importance of preventive measures to reduce the risk of infection. These recommendations, particularly crucial for those in contact with poultry, are essential for protecting both human and animal health. Avoiding contact with sick or dead birds is paramount. If contact is unavoidable, proper personal protective equipment, including gloves and masks, should be worn. Hand hygiene is crucial, with frequent hand washing recommended, especially after handling birds or their droppings. For those working with poultry, biosecurity measures are essential. This includes limiting access to poultry areas, wearing dedicated clothing and footwear, and disinfecting equipment regularly. These measures, though seemingly simple, can significantly reduce the risk of virus transmission. Section 6. Unraveling the mystery ongoing investigation. The investigation into the Louisiana case is ongoing, with scientists and health officials working tirelessly to unravel the mysteries surrounding the infection. Genomic sequencing is being conducted to determine the specific strain of the virus and its origin, providing valuable insights into its behavior and potential for spread. Researchers are also investigating the patient's history, looking for clues regarding the source of infection and any factors that might have contributed to the severity of their illness. This information will be crucial for developing targeted prevention and control strategies. The findings of this investigation will be instrumental in informing public health policies and guiding future responses to bird flu outbreaks. The information gathered will be shared with the scientific community and the public, ensuring transparency and a collaborative approach to tackling this public health threat. Section 7. Bird flu, a global threat. Bird flu or avian influenza is not a new threat. This virus, circulating among bird populations worldwide, has been a concern for decades due to its potential to infect humans and cause severe illness. The virus exists in various strains, some more pathogenic to humans than others. The H5N1 strain, responsible for the current outbreak in the U.S., is a highly pathogenic avian influenza virus, meaning it can cause severe disease in birds and potentially humans. While human infections are relatively rare, they can be severe, even fatal, highlighting the seriousness of this virus. The global nature of bird flu, its ability to spread through migratory bird populations, makes it a constant threat. Countries around the world are constantly on guard, implementing surveillance and control measures to prevent and mitigate outbreaks. Section 8. America's battle with bird flu. The U.S., like many other countries, has battled bird flu outbreaks before. Previous outbreaks, primarily affecting poultry farms, have had significant economic impacts, leading to the culling of millions of birds to prevent the virus's spread. While previous human cases in the U.S. have been mild, the recent severe case in Louisiana marks a concerning development. It underscores the adaptability of the virus and its potential to evolve into a more significant threat to human health. The U.S. government, in collaboration with state and local health agencies, is actively working to contain the current outbreak, prevent its spread, and protect public health. Surveillance efforts have been enhanced, and biosecurity measures are being reinforced to minimize the risk of further transmission. Section 9. A call to action, vigilance and preparedness. The first severe case of bird flu in the U.S. is a stark reminder that infectious diseases remain a significant threat to global health. It is a call to action, urging individuals, communities, and governments to prioritize vigilance, preparedness, and a proactive approach to public health. We must remain informed, following the guidance of health officials, and staying updated on the latest developments. Practicing preventive measures such as good hand hygiene and avoiding contact with sick birds is crucial for protecting ourselves and our communities. This is not a time for panic, but for action. By working together, staying informed, and taking necessary precautions, we can navigate this challenge and mitigate the impact of this and future outbreaks.